Hi, Dr. Soloria here with Theories of Counseling and Psychotherapy and Personality. And in today's discussion, we will talk about Gestalt therapy and behavior therapy. What we're hopeful to look at in these particular therapies or theories is the experimental method and holistic approach of Gestalt, and then analyzing techniques for exposure therapy and then cognitive restructuring. So this is behavioral, not cognitive behaviors, which we will get to later, and then look at the effectiveness of these modalities in our mental health. So with Gestalt therapy, the developer was Fritz Perls, and I know in the discussion question that it talks about looking at a video, which is pretty easily found on YouTube with Perls and his particular client. So we want to look at that. It's a very old video, but fascinating, and I find helpful in seeing how this used to be done. Also, part of the focus or core concept with Gestalt and Perls is the here and now, that personal responsibility, as he would refer to it. And the holistic approach is the mind, body, and the emotions. And we're looking at that whole person, what's going on with that client, not just what they're saying. So where person-centered, I might have been looking at, hey, they're saying this is what we're going with. With Gestalt, we're looking at, I'm going beyond the words that are coming out of their mouth, and I'm looking at their entire body. So, which has gotten tricky now that virtual counseling has become pretty prominent. We miss out on some of these nuances of what their whole body is saying. And we'll get into that more in a second. Gestalt methodology. So the empty chair, I can't say who is or who's experienced empty chair without talking to you personally. If you've never heard of that, it's totally fine. So if I have somebody in a room, in the counseling room, and maybe they've had issues with a parent, and with the empty chair technique, what I'm going to say is this empty chair sitting here represents that particular parent, and you're going to speak, as the client is going to speak straight to that empty chair as if it were the parent that they're struggling with or the relationship issue that they're having with that particular person. It doesn't have to be a parent. It can be a sibling. It can be a coworker. It can be a partner, whatever that particular thing looks like. It could be someone who has passed away, and you are having them speak to that person and have that experience. Very powerful. Need to be trained. Do not try this at home. Role-playing, reenactments. So a fun little experience I had at one particular treatment center when we were treating those persons with eating disorders, we would get into a group, had lots of groups throughout the day, and maybe in a group of 12. And the identified client, that person that day role-playing, would say what you're going to play representing their sibling, and what this person's going to play representing their father and a mother and a coworker or a school friend, any kind of relationship in your life, they would act out. And so they would tell you. So if you've been bullied at school, the client has been bullied at school, and part of this reenactment is talking about that, then they would have the bully identified in the group and be able to say what that person had said to them. That I don't like your hair. I think that you're ugly. Not kind words. And you would that participant would just keep saying that over and over and over. And so you have each participant going through and reenacting whatever might have been going on. Very powerful, very difficult. And at the end, to close it up, we would have that each person say, I'm no longer in this role of bully. I am now Dr. Soloria. I'm not playing this part anymore, and bring it and ground the person back to safety. So that's a very vague description of some role playing, very powerful work, definitely need to be trained. But there's places for those things. Um, guided visual fantasy or visualization. So that would have the person walking through a scenario, and maybe they had prep before, or maybe they're just walking through in real time in the counseling office or in a group setting, and they're just oftentimes with their eyes closed, and they're in their mind going to this place of whatever they're trying to walk through. So definitely need a place for grounding and make sure the person is safe. I want to make that very clear, because we definitely can get some disassociation going on with these type of methodologies, but I do want you to understand them. And then the body awareness and the body language. Now, as a counselor, I have to say I really appreciate this part of Gestalt therapy because I like to see what's going on with the person. I'll give you some examples of that as well. So if we're talking about a very, very difficult breakup, and I notice that the person has now started holding their breath, I'm going to acknowledge that. Hey, what's going on? Let's take a deep breath. I actually could do that without words. I'll take a deep breath and breathe it out and make it very audible, which sounds awkward. But they'll start breathing again. And we often hold our breath, especially when you get in that fight, flight, freeze state. The nervous system is going off. So noticing if they're holding their breath, noticing if they're doing a lot of nail picking. You can't see my feet, but if the foot is just tapping and going, those kind of things is like, hey, it looks like if your foot could say something, it would run out of here. Now that is something you might see with the Pearls video. He'll mention if your foot could do this, what would it do? So you're looking at that whole system, what it's saying more than the words that they're saying, because you might see things of you've seen this just in interacting with people of like, yeah, I'm fine. Or I guess I could do that backwards, but their face and their body, they're like, I'm fine, but I'm talking about just having seen a car accident. The fine and the smile and then the words coming out of their mouth are incongruent. I want to notice that. Or people go, yeah, I'm good, but they're shaking their head no. Those would be things that Pearls in Gestalt, or those who use that methodology, would point out, and they would say something about it. So as we're looking at behavior therapy, I want to keep this very clear because right now it's behavior therapy. Later, we're going to look at cognitive behavior. So they're coming along. We're not there yet, but I don't want you to confuse them. And I may be confusing you by saying them together, but I want you to hear the distinctions because that's coming. We're just not, this is just behavior. So we're looking at observable behavior, kind of like what I was just giving an example of, the head nodding or the foot shaking, the operant conditioning. So way back whenever you had psych, that you were talking about operant conditioning with Pavlov or the Reese monkeys, or I guess classical conditioning as well. So any of those behavior modalities, but also keeping in mind with behavior therapy, we're present focused, which makes a lot of sense. If I'm looking at the whole body and the whole system, I'm right here, right now. I'm not going back to Freud and what happened with a parent, right? And then thinking about the practitioner assisting through those behavioral techniques, just like I was giving demonstrations of. I am guiding this of, you shared with me that you saw a car accident, your body, your knee is shaking. Talk to me about your knee shaking right now. And then as far as exposure therapy or gradual exposure to decrease anxiety, an example of that I was given many years ago was if you have someone who has OCD. And this is a real example I got from a psychiatrist. So if you have a graph, and and maybe their OCD is around cleanliness, and they have had to have a plumber come into the house. And the spike of that is off the charts because I don't have a timeline for a plumber in the bathroom and I can't clean it. And sometimes it makes a mess because it's the bathroom and he's plumbing. So the exposure to that is the heightened um, sense of being out of control. I can't use the things that would decrease it, which would be cleaning or spraying bleach. So that gradual exposure and then desensitizing and reduction of the anxiety comes down the longer the plumber stays in the bathroom. I apologize if that example got a little confusing. I do usually like to draw it. I didn't draw anything for this particular thing talk. So that would be some gradual exposure or desensitizing the anxiety through an experience. So having them experience it, and then the longer they have to wait through that experience, then it automatically comes down. It just comes down so gradually that not all the time do they feel like it's coming down because it's very, very slow. But it does work. It can reduce anxiety for those particular behaviors. And I didn't pick OCD for any reason other than I had that example in my mind of the plumber and my former psychiatrist friend that taught that to me. So identifying and challenging irrational thoughts. So looking at cognitive restructuring. In that cognitive restructuring, I will just stay on this slide. I wanted to point out a particular scripture as far as a cognitive restructure and integration with our spiritual concepts. So if we look at Ephesians 4 and 20, sorry, I had it and then I lost my place looking at the scripture. I like to look it up. I've made notes, and earlier I messed up my notes, so I was like, you know what, I'll just use the actual word and hopefully not get lost, but here I am. Oh yes, 22. I thought it was 22. So when you were taught with regard to your former way of life, to put off your old self, which is being corrupted and its deceitful desires, and to be made new in the attitude of your minds. So I appreciate that scripture in terms of being made new in the attitude of our minds and putting off an old self. That can even be applicable to my OCD example of trying to restructure that mind and the old self being filled with anxiety and needing to release it through the behaviors or the compulsions to hopefully decrease that anxiety. I am not reducing anybody's issues to if they do read this scripture, then this. That is not what I'm saying at all. I just find it helpful as a guide. And for some people, it's not helpful. It can feel shaming. I don't want to shame anybody. But in terms of integration and looking at these scriptures, you keeping in mind, what is your focus here as a counselor in training to help someone put off some old things and move towards that restructuring of their minds and being supported through scripture, not being reduced or shamed in that process. And I'm not saying that is an all or nothing. I'm just giving a mindfulness to, hey, we can integrate. We can silently sit in prayer for a client as they're struggling, and maybe we're struggling of thinking, oh, what's the next words I need? We always have that within our toolbox, whether we say it out loud to them, that we have support. We could be praying for our clients outside of the room. And if they want that in their therapeutic experience, they get to bring that in, and we support that. But also you being grounded in your spiritual walk so that you are ready if they do ask you to bring that in. And if you are not, we always have time in between sessions and prepare and study ahead and say, hey, you asked me about this. I wanted to read that, and I want to read it with you. So there is an implementation for integration in what we do. Continue to read. I'm going to say that over and over and over again, mainly to encourage you and also remind you. Skimming, I understand there are times we have to skim and move through really quickly. Answer your discussion questions. Um, you're doing a good job with discussion questions. Here is your reference for your Corey book, as usual. Hope you have a great week. We'll see you next time.